Oh, hello there. Good morning, Mr. Davis. You're bright and early. I just got myself a coffee, actually. Great. Good to see you. How are you feeling? Yeah? Good. I'm very pleased about that. So you've injured your back, have you? Honestly, Mr. Davis, you must just be such an adrenaline addict because you're always in here for something, aren't you? Let me have a quick check on where we're at. No, I know you're dressed perfectly well now, thank you. Yeah, that's right. No, I also have your phone number. All locked away. And your age. And your measurements. No, I don't think the measurements are actually important, but I just jotted them down for my own recollection. Right. So what we're going to have to do today, I think, is we're going to have to roll you onto your back, and I'm going to give you a bit of an examination. So I'll talk you through what's going to happen today. Basically, I'll be doing a series of tests on your back. I'd like you to tell me what kind of sensation that gives you, and then you can let me know if it hurts, if it's just light discomfort. We'll go from a scale of 1 to 10, I think, and you can let me know where we're at. How does that sound? What do you think? Do you think you'll be able to manage that? Good, I'm very pleased. Well, I know you're quite used to my tender hands by now, I should imagine. Yeah. Well, I know, this is it's becoming quite a regular thing for us, isn't it? Yeah. Yeah. But that's okay, it's fine. That is what I'm here for. Yes, I know. Well, I was thinking we might just need a bit of privacy for this. If you don't mind, I'm just going to close the curtain for you. Will that be okay? There we go. Bit of privacy for us there. Just a little bit of privacy. Will that be okay? Good. Now listen, before we start today, how are you feeling? Right. Would you think it could have been that tension that has encouraged this to happen? It can be, sometimes when we're holding extra pressure across the back of our shoulders. And you think it just happened in your sleep. Oh, that's dreadful. I'm sure if I'd been there, I would have given it a quick rub and just eased it away. Not that I would have been there, obviously, because I'm your doctor. Right, so before we turn you over, I'm just going to check your chest a little. Just check that our heart rate is going well. So I'm just going to slip this, warm it up for you. There you go, nice and warm. I'm just going to slip that and go just up your top a little bit. And are we ready? That's sounding well. Lovely. Can I just do the other side? Just popping it in there. We can just, there we go. That's it. Yeah? I'm quite happy with that. Yes, it is speeding up a little bit, but we have spoken about this before. It's not unusual for my patients to get a little bit frisky at times, and I'm quite all right with that, you know. I don't mind it, really. Right, so if you're ready, I'm going to get you to move that hair away from your face. Let's just get you to turn over. So if we can just, taking the body, if we can just roll yourself over. That's it. Over you go. Over, please. Oh, that's lovely. There we go. I'm just going to open up your gown. Is that all right? There we go. Let me just open that up and separate that. There's your back all splayed out. That's very nice. I'm just going to bring you down slightly. There we go. Right, we're going to start today. I'm literally going to start with a gentle rub. Okay? So I'll be rubbing your skin very gently to begin with. I just want to see how sensitive we're feeling today. So if you can imagine, it's just going to be a gentle, just like that. How does that feel? Good. Good, I'm very pleased. I'm going to just, if you don't mind, I'm just going to, that's it, I'm going to get my fingers right into those knots. Let's work it out a little bit. Let's push that out a little bit. You are very tight along this area here. I'm just going to push in a bit more. There we go. Right, and I'm just going to work down. If we can just work all the way down. Well done, all the way down to here. Right, yeah, I can definitely feel we've got something going on here. Can I just... I'm just gonna buff away the skin slightly. So you'll just hear slight buffing. I'm just gonna buff that, there we go. Just in there, area there, we go. Just going around the area. I'm just going to go in a little bit more gently now. That's great. Today it's awfully hot in here. If you don't mind, I'm just gonna relieve myself a little bit because it's getting quite steamy in here, isn't it? Don't know if it's just me or perhaps you as well. Right. So also, I'm just going to work on your spine for a moment. You're just going to feel a pulling sensation. Do you feel that? Lovely. And again. That's it. A bit more, a bit tighter this time. Well done. That's painful. Okay. I'm going to go in a bit more gently. Is that easier? Good, good. Okay, I'm not unhappy with that. That's fine. We are going to have now. This can sometimes feel a bit like elastic bands pulling in the back. We're going to be stretching the spine out. We're pulling the spine, all as if we were just yanking on our gloves, just stretching it right out as best we can. So, are you ready? So I'm gonna get right in there, if you don't mind. Let me just get right in close. Okay, are you ready? Okay, prepare yourself. That's it, and a bit more. Ready? Well done. Keep breathing for me, if you can breathe through it. In and out. Excellent job. One more, here we go. Oh, that's fantastic. Just a tiny inch more. I think that's done it. I think that's probably ease that area off. Let me have a little look. If I just get in with my fingers now, how does that feel? Yes. And if I go in at the top again. Great job. Right, I just noticed there's just a tiny little ingrown hair. It's not part of the procedure at all, but actually while I'm here, I've got my tweezers. Why don't I just get in there and clear that out for you? Does that sound worthwhile? Mr. Davis, you know me. I love to give a little extra. So come here. I'm just going to get in. Don't you worry. There's no pain involved in this. It'll be very quick. Painless. Just out. Like that. Out. Ready? Okay, and I'm just going to... It's done. That's it. That's it. All done, Mr. Davis. All cleaned and sorted. We'll pop that away. Right, I'm just going to be going in now. I've just got a tool here. I'm just going to be giving your back a little tap along the spine, okay? Just a gentle, it's very gentle. You feel that? Right, here we go. Just pop those back on for a moment. Are you ready? All the way down the spine, here we are. Well done. Perfect, I'm going to go right down to the coccyx. Right into the coccyx, that's great. And yeah, that's marvellous. Yeah. Coming back up again. Going to come right back in close. All the way to the top. And I'm just going to take Where have we gone? Oh, here it is. Just got a little bit of jelly here. And what we're going to do is we're just going to take that small amount of jelly, see that? We're just going to pop it on my gloves. There we go, just going to get it all warmed up, rubbed in. See that? Yeah? Can you feel that? Good. I'm warming it up for you. I'm not going to pop it on you until it's nice and warm. I know you don't like anything too cold being slapped on that back of yours. So here it is. There we go. There it is. Nice and warm and ready. And ready. Do you see that's ready? So I'm going to lock my fingers in and I'm going to really push down. Yeah? So I'm going to lock them. Get them and lock them in tight and give them a good push down. How's that? I'm just going to work a little bit. Let me work a bit more into those shoulders. There we go. Good job. Oh, that's it. I think I can definitely feel, yeah, I feel that's great. Yeah, can you feel that on the gloves? Yeah, brilliant job. Lovely. Well, I think I'll just take this. I'm just going to just give you a little wipe down. A little wipe down, get that off you. I think you've done pretty well today, to be honest. I think, yeah, you should be super proud of yourself. I know it looked like it was going to be a really, really painful procedure, but they don't all have to be painful procedures, you know. I think it's often worth realising that not every procedure is painful. So, now that I've got you turned over, could you do me a favour, Mr. Davis? I just want to be sure before you get up that you're not dizzy or confused. So I'm just going to bring my light in for you. Could you just look into that light for me? That's great. Looking into it, deeply into it. If you could just look really deeply into my eyes. Sorry, into the light. Look deeply into the light for me. Wonderful. That is a wonderful job. Yeah, so I think we're more or less done for today. Yeah. Well, I'm hoping for your sake that actually we're all done and you won't necessarily need to come back in for a little while. But of course, if you'd like to come in and visit me, as you know, I love a good visit, and especially from you. You're always welcome to pop by the surgery anytime. Yes, night or day. I'm always here, always on call. Dr. Anna, always on call. Okay, Mr. Davis. Well, I will see you very, very soon. Happy listening, my darling. Hi, and thank you so much for watching today. And if you've enjoyed today's video or any of the others, please do like and subscribe so I can make many more. And if you were looking for something perhaps a little not safe for work, please do join me on my OnlyFans page or my Patreon page for some very grown-up stories. Happy listening, my darlings.